and welcome to the Thomas J. Long School of Pharmacy and Health Sciences at the University of the Pacific. For the past 60 years, our school has provided innovative programs as well as leadership opportunities to students from around the world. University of the Pacific is nationally accredited and recognized as the first pharmacy school in California to offer an accelerated 3-year program. Our students are guided by dedicated, experienced professors who offer hands-on learning as well as the opportunity to participate in innovative research. Our school is not only strong academically, but also encourages the growth of a well-rounded pharmacist. Students are encouraged to get involved in our numerous campus organizations, committees, or classes that promote both professional growth and community activism. One of our most prominent community outreach programs, and one that we are passionate about, is our Medicare Part D program.
If you take a look around, insurance is all around us. It allows us to own a house, drive a car, travel safely, and most importantly, protect ourselves and the ones we love in case of an emergency. It should be no surprise then that health insurance and drug costs have become such important topics in society today.
One type of prescription drug insurance, called Medicare Part D, helps subsidize or partially offset drug costs for the elderly, disabled, and others with Medicare. Nearly 58 million Americans, or roughly 1 in 6 Americans, have Medicare in our country. Although Part D helps offset cost of prescription drugs for those with Medicare, certain challenges remain. There are dozens of different Part D plans, each with a different formulary, which is a list of covered medications, and cost-sharing structure, which is the amount you have to pay for your medications at the pharmacy. We have found that approximately 80% of those with Medicare Part D can save money, on average $1,030, by switching their prescription drug plan.
However, the ins and outs of Medicare are really complicated and not entirely intuitive for many people who have Medicare Part D. So in order to promote a community of pharmacists better adapted to the changing political and economic environment, the University of the Pacific has created a nationally recognized Medicare Part D program. Students of our Medicare program help optimize a patient's Medicare Part D plan, thereby minimizing their out-of-pocket prescription drug costs. Students also review all of the patient's medications to ensure that they are safe and effective to take together. At UOP, we are committed to being strong advocates for our patients and agents of change. Our Medicare Part D program not only allows students to become experts on the ins and outs of the Part D prescription drug benefit, but it also presents an opportunity for students to provide medication therapy management, or MTM, which ensures that a patient's medications are both safe and effective to take together through comprehensive, systematic process.
The Medicare Part D program is the classroom to the community. We take what we learn in class and use it to improve patient economic, clinical, and quality of life outcomes during health fairs. In the fall, we will have 14 health fairs in 10 different cities, during which we will see about 1,500 patients. During the typical health fair, we will have over 100 student pharmacists, licensed pharmacists, and government volunteers providing health screenings and services.
As pharmacy students, we are a patient's health advocate. We educate patients to ensure that we prevent drug-drug interactions, medication side effects, improve medication adherence, and so much more. We also provide patients with their own personalized medication record in their preferred language. Moreover, we provide a dozen different health screenings and services at each Medicare health event, including immunizations, blood pressure, cholesterol, diabetes testing, bone density screening, mental health screenings, and so much more.
So, how can you get involved? This fall, we have 14 Medicare events all over Northern and Central California. So if you're interested in seeing us in action and learning more about the University of the Pacific, book a trip. Come to our campus and visit one of our Medicare health fairs. While you attend, you'll have the opportunity to shadow students working at health screening stations and sit side by side with us as we perform Part D and medication therapy management services. You'll also get one-on-one time with a UOP faculty member, someone who might be interviewing you, get tips on your application, and get all your questions answered. Additionally, if you speak a second language, we would love for you to lend your skills. That way you can have hands-on experience and be a part of delivering the services. And even if you can't attend, we would love for you to spread the word to any friends or family you may have in the area that might benefit from these services. We would love to have them come to one of our Medicare health fairs. More information about our Medicare program can be found at go.pacific.edu/Medicare. Thanks for having us, and I hope to see you in the fall.